Net Health, in collaboration with other health officials, provided an influenza update to the media this morning. Here's more.
Flu, just kind of big picture across the country, there will be any given year up to 23,000, 24,000 fatalities in the United States, and about over 200,000 people will be hospitalized. So the burden in a normal year is high. If you look at Texas, we'll have well over 1,000 fatalities generally in the state of Texas, with about 18,000 hospitalizations. But this year's strain is a little bit different. We feel like, based on our observations, the intensity is higher and the seriousness is more extreme. And I think you guys have all been seeing that and hearing that. We do know what our major culprit is this year. It's the H1N1 virus. And if you think of flu, it's not one particular virus. There's several subtypes. There's alphabet soup, there's A and there's B, then below A there's even different subtypes. There's H3N2 and H1N1. But this year's strain is the same one that came on the scene in 2009 when we had the pandemic that started in Mexico and moved itself up in North America. It was a new strain, a new variety. We started creating vaccine back in 2009 to combat that variety. It's always been there since then. It's been in the background. Now it's considered more a seasonal strain. So based on the lab tests that we have sent in from East Texas and all across the country, about 95+% of those have been this H1N1 variety. So generally the highest rates of flu occur in the very young, and the people that get ill most seriously with it are those over 65 years of age, again, young children and people with underlying medical conditions. But this year particularly, young working age adults, 20 to 50, have been getting flu more seriously at a higher rate, and there have been some fatalities in that age range.
I know everybody hears about every year, and that's the vaccination and prevention. And yet, sadly, it's one of the issues that still drives a large concern, is that it's amazing how many of our patients, despite hearing the concern about vaccination, still don't get their vaccines. There's always the concern that, well, I get the flu from the vaccine. The bottom line is, no, you don't get the flu from the vaccine. The reason why you might feel a little flu-y after you've had the vaccine is because your body is launching an immune response and getting all the antibodies ready. And it's really, really important, if you can, try and get this message out about vaccination and prevention. As you've just heard, the vaccine needs to be given to children over the age of 6 months. This is a recommendation from the CDC and the Texas Department of State Health Services. It does, however, mean for children under the age of 6 months that it's really important that those taking care of them do go ahead and go get their vaccines. Anybody taking care of the elderly or anybody with chronic illnesses too should get the vaccination. As you've heard, this year the vaccine is covering the H1N1. There are three components to what is called the trivalent. There's the H1N1, the H3N2, and then there's also the influenza B component. You may also hear about the quadrivalent, and that has an additional influenza B component to it. So really, if you can get that message out about vaccination, we'd be really most appreciative. Most physicians, most pharmacies right now, if they don't have it available, it is on back order and they're getting the vaccination. But as of today, everybody who needs a shot should be able to get a shot in Smith County. The other important thing is the prevention, and if you can just get this message out. In fact, I'm sure a number of you have seen even colleagues coming to work who are sick. My wife was saying the other day she had to ask one of her colleagues to go home because they bring in the influenza to the environment. Get the message out if you could. If people are running a fever, not feeling well, stay home, because you bring the virus into the workplace and you get more people sick with the illness.